An intensive care unit is a special department of a hospital or healthcare facility that provides intensive care medicine. Intensive care units cater to patients with severe or life-threatening illnesses and injuries, which require constant care, close supervision from life support equipment and medication in order to ensure normal bodily functions. They are staffed by highly trained physicians, nurses and respiratory therapists who specialize in caring for critically ill patients. ICUs are also distinguished from general hospital wards by a higher staff-to-patient ratio and access to advanced medical resources and equipment that is not routinely available elsewhere. Common conditions that are treated within ICUs include acute respiratory distress syndrome, septic shock, and other life-threatening conditions. Patients may be referred directly from an emergency department or from a ward if they rapidly deteriorate, or immediately after surgery if the surgery is very invasive and the patient is at high risk of complications. In 1854, Florence Nightingale left for the Crimean War, where triage was used to separate seriously wounded soldiers from those with non-life-threatening conditions. Until recently, it was reported that Nightingale reduced mortality from 40% to 2% on the battlefield. Although this was not the case, her experiences during the war formed the foundation for her later discovery of the importance of sanitary conditions in hospitals, a critical component of intensive care. In 1950, anesthesiologist Peter Safar established the concept of advanced life support, keeping patients sedated and ventilated in an intensive care environment. Safar is considered to be the first practitioner of intensive care medicine as a specialty. In response to a polio epidemic, Bjørn Åge Ibsen established the first intensive care unit in Copenhagen in 1953. The first application of this idea in the United States was in 1955 by William Mosenthal, a surgeon at the Dartmouth Hitchcock Medical Center. In the 1960s, the importance of cardiac arrhythmias as a source of morbidity and mortality in myocardial infarctions was recognized. This led to the routine use of cardiac monitoring in ICUs. Especially after heart attacks, hospitals may have various specialized ICUs that cater to a specific medical requirement or patient. Common equipment in an ICU includes mechanical ventilators to assist breathing through an endotracheal tube or a tracheostomy tube, cardiac monitors for monitoring cardiac condition, equipment for the constant monitoring of bodily functions, a web of intravenous lines, feeding tubes, nasogastric tubes, suction pumps, drains, and catheters, syringe pumps, and a wide array of drugs to treat the primary condition of hospitalization. Medically induced comas, analgesics, and induced sedation are common ICU tools needed and used to reduce pain and prevent secondary infections. The available data suggests a relation between ICU volume and quality of care for mechanically ventilated patients. After adjustment for severity of illnesses, demographic variables, and characteristics of different ICUs, higher ICU staffing was significantly associated with lower ICU and hospital mortality rates. A ratio of 2 patients to 1 nurse is recommended for a medical ICU, which contrasts to the ratio of 4:1 or 5:1 typically seen on medical floors. This varies from country to country, though, e.g., in Australasia and the United Kingdom, most ICUs are staffed on a 2:1 basis or on a 1:1 basis for patients requiring extreme intensive support and monitoring. For example, a patient on a mechanical ventilator with associated anesthetics or sedation such as propofol, midazolam and use of strong analgesics such as morphine, phenytoin and/or remifentanil. International guidelines recommend that every patient gets checked for delirium every day. There are translations of these tools in over 20 languages and they are used globally in many ICUs. In the United States, up to 20% of hospital beds can be labeled as intensive care beds. In the United Kingdom, intensive care usually will comprise only up to 2% of total beds. This high disparity is attributed to admission of patients in the UK only when considered the most severely ill. Intensive care is an expensive healthcare service. A recent study conducted in the United States found that hospital stays involving ICU services were 2.5 times more costly than other hospital stays. In the United Kingdom in 2003-04, the average cost of funding an intensive care unit was Some hospitals have installed teleconferencing systems that allow doctors and nurses at a central facility to collaborate with on-site staff and speak with patients. This is variously called an EICU, Virtual ICU, or Tele-ICU. Remote staff typically have access to vital signs from live monitoring systems and electronic health records, so they may have access to a broader view of a patient's medical history. Often bedside N.